Hey, everybody, and welcome to The Brand Called You. So, listen, I want to tell you a story. About 15 years ago, I was in a health food store. I had decided to eat healthy, and I see these seaweed snacks on the shelf. And I get all excited because it's supposed to be the alternative to potato chips, no calorie, gluten free. And this whole box is on sale. So instead of just buying one bag, I bought a whole box. I took it home. I started snacking. They were delicious. And I thought I could eat 5 of these because it's calorie free and it's healthy. But the next morning, I woke up and I thought I was having a heart attack. My heart was racing. I had all the symptoms that, everything going down my arm, tightness of chest. And even though the symptoms abated, I said, I better go to my cardiologist. And I marched off to my cardiologist and he ran all the tests on me. And he came back with an answer. He said, "You're fine." I said, "I'm fine." Well, he said I was fine. I believed him. The symptoms went away. I thought maybe it was too much coffee. But 2 weeks later, the exact same thing happened. But I stopped this time and I said, wait a minute, what did I just eat yesterday? And I realized it was those seaweed snacks. So of course I Googled it, and there it was right in front of me. They're filled with iodine. And if you have Hashimoto's, an autoimmune disease like I do, which is a thyroid disease, it can make your thyroid go crazy. It can be quite dangerous. And I realized I had been having too much iodine without realizing it. Well, I thought my cardiologist would be so excited when I told him I had found the answer. But you know what he said when I told him? He said, "That's ridiculous. I don't
Oh,
believe you." And it was very upsetting to me, but it was not atypical. My experience, like so many people from all over the world, is we go to traditionally trained Western doctors who only look at the symptoms. They don't look at the root cause. They never ask us what we ate, and they never think about the big picture. That is until my guest today. And that's why I'm so excited to introduce our wonderful, wonderful guest, Beatriz Olson. And I'm going to tell you a little bit about her before we meet her. Beatrice is an integrative endocrinologist. I don't know if you've ever heard of that before. I certainly did before meeting her, but she's so much more. She's also board certified in metabolism, diabetes, internal medicine, and age management medicine. She founded an organization called Lotus, which is professional integrative medical community. And she also has additional training in meditation, Ayurvedic medicine, and Jungian psychoanalysis. But if that wasn't enough, she also has just written a fabulous new book called Mind Body Secrets, a medical doctor's spiritual and scientific guide to wellness. So I can't thank you enough for being here. Oh, there it is. Great. Thank you so much for being here. Welcome.
Lisa, thank you so much for having me and giving me this opportunity to connect with the world, connect with you, and share stories.
Well, I think that I want to start for people that might not have ever heard of integrative medicine or integrative endocrinology, what it is, and also the story that I told. I'm sure that people that come to you have the same story that I do. So maybe you could share with us what it means to be an integrative physician versus the kind I described to you prior.
Right. So it's a very good question, and there's very few of us around. But I am board certified in the field of endocrinology by the American Board of Internal Medicine. And that means that I'm an expert in all kinds of thyroid problems. And I happen to be in particular an expert in thyroid disease and menopausal transitions. But an integrative doctor combines not just what we learn in the conventional medical system, which is disease-centric. An integrative medicine doctor looks at the whole person. It's more of a holistic approach. So I was very interested, and I learned from Dr. Deepak Chopra late in the 90s about mind-body medicine. And this blew my mind, how amazing it was that I could have grown up in a system that only focused on fixing what is broken, what is sick, whereas there's systems in which it has been known that the body has innate capacity for healing. And that if we give it the right things, the body heals itself, and that there's indeed a spectrum between wellness, being totally well, and then loss of wellness to developing disease. Do you understand that? So integrative medicine combines complementary medicines such as using mindfulness meditation, yoga, massage, craniosacral work, all sorts of treatments to help an individual return to its wellness. In addition, nutrition is very important here because, as you know, we have a problem with obesity in the world. We have diabetes in the world. We have these big epidemics, which are probably due to the fact that we eat a lot of processed foods. And these foods are not natural for our body. They hurt us. They give the wrong signaling biologically. And why should that be? We are ancestral creatures. We are slowly evolving through millennia. And yet the world has changed in the last 100 years. And the signaling and the messaging that we're getting is counteractive. It actually is disruptive to our natural biology. As a result, we're getting sicker and sicker. So that's why I'm an integrative physician, because I truly believe that to help a human, you have to connect to their wholeness and invite them to return to their wholeness and themselves. And by teaching people to know what is important, they know then how to fix themselves. Often a lot of people don't know how to help themselves. So that's integrative endocrinology.
I mean, in your book, you talk a lot about the gut inflammation. You say that gut inflammation leads to brain inflammation. This fascinated me. I guess my first question, before we get to that, is why is that not the first question that every doctor asks you? What did you eat yesterday? I never have been asked anything about my diet in relation to any disease or any problem I've ever had. What is going on in the medical schools that they're still not connecting that?
So what is very interesting about this, and it's still present now, this problem, is that nutrition is not a core curriculum in the medical schools in the United States. It's an optional thing that you can take on the side. So, and this is even happening now. I happen to be a member of the nutrition committee for the American for the American Medical Women's Association. And it turns out that it's difficult to bringing into the regular practice, asking patients about their nutrition. So it's still an archaic system that doesn't embrace the possibility that there's something having to do with nutrition that alters outcome. And instead, now we're giving medicines to help people lose weight because the system doesn't have a sense that humans have the capacity to help themselves. And in some ways they don't, because once we gain weight, the brain thinks that it has to protect our highest weight because that is the defended weight, because we're creatures of the millennium. So we were made to survive in scarcity and to reproduce and to eat every time we found food. And that's why we always find food delicious. We have abundance around us. Most of us don't have an epidemic of no food or scarcity going around. So as a result, we continue to get larger because our brain always wants more. And we have to learn to tell the brain, sorry, but we're not in a major right now lack of food, and we can allow our bodies to sort of work together so we don't have to eat all the time that we see foods or every time that there's a snack around.
But can you talk a little about gut inflammation? And you talk about it in your book about how it can lead to all sorts of terrible things. And I don't think many people understand what that is exactly.
Yes, so it turns out that just like we have senses outside to tell what is going on around us, like you can see, you can hear, you can touch, you can sense, all of these senses that we have give us information from the outside. But it turns out that inside of ourselves, through our digestive system, there's a whole world of bacteria. These are called the microbiome. And these bacteria are sensing what is happening with the nutrition inside of us. And they're sending signaling through the vagus nerve up to the brain, telling it what's going on inside. So the brain and the body has various mechanisms of knowing what is going on with it. So it turns out that if we eat good foods, a whole food means that it's itself. It doesn't have a zillion ingredients put to it, or it doesn't have a shape made by a machine. So you have to digest it yourself. If you have good whole foods, lots of plants and vegetables, you're going to have good bacteria in your intestines that are going to protect you. So for example, the non-digestible fibers in vegetables are delicious foods. They're prebiotics for the good bacteria in the intestines that helps you to keep the intestine healthy and intact and allows for good mucus to happen. So if you think about this, like the intestine is this little circle, right? It's a circle. And if you look at my fingers, they are tight membranes. They're not opened. They're tight, okay? So what happens is that if there's the wrong bacteria or inflammation, and we don't have the right bacteria to keep these junctions tight, what happens is that they open up. And what's inside of this intestine begins to come through the walls of the intestines. And this is met by an immune system that says, oh my God, we have invaders here. So what do? They start fighting what is coming in and developing antibodies for this. But what happens is that these antibodies are not necessarily targeting just those bacteria, those negative pieces of bacteria in your intestines. What is going on is that these antibodies can bind your thyroid or an antigen in your thyroid and begin inflammation in the thyroid and cause autoimmune disease. They can go to the pancreas and cause type 1 diabetes. So inflammation in general can cause a lot of havoc in the body. And it can also affect the brain. So that if you're feeling foggy in the mornings, if you're feeling as if you have an infection in your body, or it's because you have inflammation in your body, you know, and these are things that are really, if you start understanding the biology of things and how important inflammation is in terms of outcomes, inflammation and high insulin are probably responsible for our aging. That's how we age faster. And, you know, we can age much more slowly if we eat less and if we eat good foods and if we move around all the time and respect the rhythms of our body and allow ourselves to sleep when we should and wake up when we should, because the hormones are secreted based on night-day cycles. So the gut is so crucial to know what is going on in the body and how it's going to be processed. Remember, you are what you eat.
So you talk also in your book quite a lot about stress and also family dynamics, internal and external family systems. Maybe I've never really heard a medical doctor approach disease like that. Maybe you could sort of articulate why you think that's important.
Yes. So it turns out as an integrative medicine physician and a mind-body doctor, I truly believe that the mind and body are connected to each other in a very energetic way, as is the spirit. And in fact, our bodies and our minds and the spirit actually regulate health outcomes for us. So if we, for example, imagine that you're a person that has been hurt, you have been sexually hurt by someone when you were younger and you were growing up and you were beginning to become a woman, let's just say. Mm-hmm. You may have in your mind decided to protect yourself by gaining weight so you don't get hurt. Mm-hmm. Later on, you may have gained enough weight that now you have pre-diabetes or you are developing diabetes. And now you want to lose weight. But every time you lose weight, for example, somebody may come by and give you some comment about, oh, you lost weight or how your body is. And all of a sudden that triggers a fear signal in that younger part, that person that you were when you were 17, even though you're now 40. Okay. And the 17-year-old says, oh my God, we can't continue to lose weight. It's dangerous. So we start gaining weight again, even though we were losing weight and exercising. Why is that? That is because, and we all know this, we all know that there's different parts of ourselves. It's not that we are multiple personalities, it's that realistically, all of us have different younger parts of ourselves that have had experiences when we're younger. And these experiences sometimes were we had parents that helped us process the experience. But sometimes we didn't have parents, and sometimes we didn't have anyone to, or we were too young to be able to process the experience that we were having. As a result, these little parts of ourselves become disenfranchised. They don't belong fully to us. And they act out when they're triggered by different things that go on around them. So I'm sure that you have sensed that you behave in a certain way when you see friends from 10 years ago that you haven't seen before. You return to that persona. So what we want to do is try to understand what parts of us are acting out when we're triggered by something. Ask, what part of me is that when I was younger that felt this way, that felt rejected, that felt disenfranchised, that felt unrespected, unlistened to, whose boundaries were broken into? What part of us was that? And can we, as wiser adults, acknowledge and investigate what happened to those younger parts of ourselves and see them with love and compassion? Often habits and behaviors we have are simply primitive mechanisms to protect ourselves from the time we were younger. And if you're able to understand that and tend to those younger parts of yourself with love and thank them for their hard work all this time to trying to help you and acknowledge their suffering, then you can tell them that they can relax now, that you, the adult, can protect them. You're in charge. And often then we can begin to become whole as opposed to being led by younger parts of ourselves. It's like having a house without a parent, and 4, 6, 8-year-old kids just running around running the show. So we have the capacity to do this, to reclaim our wholeness through connecting to ourselves. And that's a big part of the book.
I mean, you have a beautiful story about your own experience growing up in Cuba and having to experience food deprivation and rationing. And then when COVID happened, something got activated in you. Maybe you could share that story.
Yes, and this happened it was incredible. I decided in Cuba we would ration food. So it was my father, my mother, and 4 little kids. And you can imagine that a piece of steak was cut into 1,000 little pieces and put in rice so that everybody would have it. And that would randomly happen because food was rationed and we rarely had any meat. So when COVID came, I decided to put my husband and I on a rationing program and to make the foods last. I didn't buy more food, whereas some of my friends did, and some friends bought refrigerators and froze things. I decided that it was unfair to buy a lot of food because everybody needed to have a fair amount of the foods. So I kept buying the same amount of food, but I rationed us. And all of a sudden, after a few weeks, my husband rapidly lost 6 pounds and I was losing weight too. And then he said to me, don't you think that there is still food out there and that we might increase the amounts of foods that we're eating? And a part of me, when he said that, got really sick. I got nauseated to think that he was saying this to me. And what I recognized is that who was anxious that there wasn't going to be enough was a younger part of myself that lived in Cuba. And even though I never had food scarcity per se that I remember, I know what one has to do when there is no food. And that was ingrained in me as a child. That was no longer necessary as an adult, but I had to actually tend to that younger part and say, yeah, I understand you had this suffering. I understand that you're not feeling well, that your stomach hurts because we're not being thoughtful enough or careful enough with the food, but I'm in charge. There is enough food for everyone. I had to reassure that part of myself. And all of a sudden the stomach pain went away. So I was able to give us the food, back the food. And then our weights got back to normal. But I was like, this part
Yeah.
of me just said, stop right there.
Yeah.
We got to protect everyone.
Yeah. But so you're talking about, just to a large extent, behavior modification due to self-awareness. But I have a different question. My mother is a Holocaust survivor, and there's been many studies. In fact, I participated in one with a doctor at Sinai years ago, which shows that not only do Holocaust survivors have post-traumatic stress disorder, but it is epigenetically inherited by their offspring. So that even without me being aware of it, even without me having any behavior, I already have a predisposition towards, a stress, cortisol levels being out of whack. So how would you approach, just having an epigenetic predisposition, something that despite my best behavior, I inherited? How can you, as an integrative endocrinologist, kind of address that issue? What we inherit physically.
So for me, the thing is that all of these epigenetic events having to do with stress have to do with post-traumatic stress.
Mm-hmm.
They're very terrible, terrible events that have been hit us over and over again, and the brain can't integrate them in one place. And because of that, we keep on reliving the events. We get triggered by these events. And what happens is this causes an altered biology in the body. And it's a hyper-reactive. You hyper-react to things. I myself, I'm a trauma survivor from being in Cuba and my parents being harassed in the process of leaving as political refugees to Spain from Cuba and escaping from communism. So I am like that too. If something happens, I'm highly triggered. And so what have I done? What can we all do? And what happens is the best way to help ourselves is to learn how to activate our calming nervous system. Because what happens is that if we right now live under constant stress, life is stress, work is stress, news is stress, everything we see is terrible. So we're always being bombarded by stimuli that tells us that things are not well. In addition, we don't sleep enough. So we're more reactive, where our threshold for being bothered is much lowered, if that makes sense. So the way to counteract this is to do what we called mindfulness. I think that in other traditions, it would be called meditation. It would be called the Dharma. It could be called many things. But the practice of taking time to be with what is, and time to give ourselves quiet, to breathe into our own spaces and to connect to ourselves and to the essence. That's the way to calm down the nervous system. Even if you take a slow breath, counting to 4 and breathing out for 6 counts, and saying that I bring life and I release. I bring life in, I release in the thoughts, and you do count for 4 in the inspiration. So 1, 2, 3, 4, and breathe out 1, 2, 3, 4, 5, 6. And if you do that cyclically, what happens is that you actually activate the calming nervous system. And when you do that, something happens, and we have to build up that calming nervous system because we have too much activation. Do you see the difference? We're supposed to be in balance between the active and the calming, and we have too much active and not enough calming. You understand? So by doing these exercises regularly and training our brain to think differently and to be kind to ourselves, to soothe ourselves under these circumstances, that's called mindful self-compassion. So a combination of actually tending to ourselves and breathing and taking the time before we go to sleep, perhaps, and early in the morning to calm ourselves. It only takes a short time. It's incredibly healing for the nervous system. Also for trauma, we can do movement therapy because trauma is stored in the body. Different parts of our body experience our trauma, so that it is important to do body work. Yoga can help, and dancing can
What do
work.
you mean it's stored in the body? Could you explain that a little?
Oh, absolutely. I think that if we are traumatized or if something bad happens to us, the body remembers. The body remembers or holds it in a certain place. Or, for example, think of something that made you sad. Okay, if you just take a moment to think about something that made you sad, where in the body does that happen? You know that sometimes you can feel it in the throat, or you can feel it in the heart. Sometimes think of when you're rejected by someone or when you have not been wanted. And if you focus on that, there's a place where that is. Women that have been sexually traumatized cannot do certain positions, like they can't do certain positions in yoga because they're terrified. And then there's therapies that counteract, like there's horseback riding that can counteract this effect and reconnect the person. So that there's many ways that we can have our feelings, our emotions, and our hurts, they're held in the body. And one of the tasks when we talk to these younger parts of ourselves is to say, where do you feel it? Where is the boo-boo? Where is this happening with you? And sort of touch that place with love and say, I'm sorry that happened to you. I'm sorry.
I'm so curious, how did you come to pursue this wider approach to medicine? You went to medical school like everyone else, right? And I'm sure it was a traditional medical school. I don't know where you went to medical school, but
Well, I went to the most amazing systems. I went to Barnard College. I went to
okay,
Columbia University, the College of Physicians and Surgeons, the University of Pittsburgh. I worked at the National Institutes of
right.
Health in the United States. So I went through this whole process. But what I discovered was that when I started to work with people outside of the educational system, people needed more. People were coming to my office saying, do I have a thyroid problem? I feel horrible. Do I have this? Do I have that? And after evaluating them, their thyroid was working well, but something was clearly wrong with them, And I didn't know at that point how I could approach the wholeness of a person. And that's how I discovered mind-body medicine.
But
And
didn't your colleagues think you were just being a little bit crazy at the time?
I've always been different than everybody else, truly different. I'm the only woman in my practice that has her own private practice at this time and that practice mind-body medicine. I've always been very different, but I've been consistent. I've been consistent. And as a result of that, I have been, even in this environment where no one has private practices anymore, I have had the honor of taking care of 6,000 people. 80% of these have been women because women are the people that experience endocrine disease.
Yeah. So I just have a couple more questions. I'm sorry, there's so many things that I'm curious about. Obviously, you keep up on all the literature surrounding endocrinology, and I'm just curious if, there's so much been said now about hormone replacement and this and that, but is there a kind of natural way to bring back some of those hormones or to change the shift without having to take as women age? I mean, are you finding, or is there research to suggest a more non-medicine approach, you know what I mean? In other words, can all of your techniques genuinely affect the endocrinological state of somebody?
Oh, absolutely. I think the mind is so powerful at controlling the hormones of the body. When we're stressed, the adrenals are pumping, you know, and the adrenals pumping make us insulin resistant, makes us gain weight. When we're stressed, our metabolism slows down by 160 calories. When we lose estrogen, our metabolism slows down further and we continue to eat the same, and that's how we gain weight. So, in fact, there are ways to use the mind to calm the body and to have it be at best balance. However, I want you to know that we, as I mentioned, we're ancestral creatures. In the past, we were just made to reproduce and to bring the next generation and to survive in scarcity and in famines. So now the world is different. Now we live until we're 80 years old, but
Yeah.
the hormones go away 30 years before that. And when the hormones go away, your mind, and it's a message to the universe that we have become residue, garbage. So it makes sense, since we live now much longer, and if we have safe ways of using and replacing hormones, that we maintain our hormones in the best place. Of course, there are, and we can use bioidentical hormones. I actually have a lecture, a master class in menopause, which women have loved very much. It's in my YouTube channel, which is called Integrative Endocrinology with Dr. Beatriz Olson. But the point is that it makes sense to give hormones if we can to people, except if you have breast cancer, if you have a serious breast cancer history, those are no-nos, or if you've had a blood clot.
Right.
We absolutely, or active heart disease, you're not a candidate. And primarily, if you've been without hormones for more than 10 years after the menopause, it's not the best to use hormones later on, because the hormones affect the body differently after being gone for a long time. But you can still use other hormones or other ways to help yourself. And also, if you cannot take hormones, there's fabulous new ways that are available to deal with the hot flushes and the night sweats and the vaginal dryness and all of the things that happen to women when they go through menopause.
I wish I'd met you 15 years ago when I should have been doing it. But it occurs to me that your experience as the child of inherited trauma probably paved the way for you to have that heightened sensitivity to your patients initially. And I mean, do you think that it is because you had that hyper radar due to your own background that you gauged that there was something more that was missing? And, do you think it fueled your practice, your own background?
Well, there's two things. I think I learned in Ayurvedic medicine that people are born with Prakriti and Vikriti. You're born with a certain sense of, genetic wisdom that is in your DNA from the Big Bang. And then you have other things that, you carry with you, that are different. Your parents can give you things, but you bring your own stuff, and then the universe gives you other stuff. So there's two ways that are coming here. From my prior trauma, from coming to Cuba and becoming sick and obese, being abused by people for being Hispanic, for being fat, for being not being the other, I developed a lot of sensitivities. And when you suffer, you develop compassion. And if you don't become a victim with your suffering, you become empowered to help others. You have bigger heart, and you're driven to make a difference in the world. And I was fortunate through my training that I became healthy weight. I've been the same healthy weight for 40 years. I have helped thousands of women do the same. And I was informed. I think that's a very good question, Lisa. What is it that drives us to be the best that we can? What drives us to serve the world? And it's our prior experiences.
Well, I can't thank you enough. Obviously, I could go on for hours, but it was just such a pleasure learning about your approach and your new book. And I just look forward to following you in the future. Absolutely. And we'll have a link to it on the website. But thank you so much.
Lisa, thank you so much for the
Really
opportunity.
a pleasure. Okay, I look best of luck to you, and I'll be following.
All right. See you soon.
Thank
Bye-bye.
you so much. Bye-bye.
Thank you for listening to the Brand Called You videocast and podcast. platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website www.tbcy.in to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for the brand called You.